Hello, welcome to another video. Today, we are going to see about aplastic anemia. So, before that, please subscribe my channel, and if you need the notes for today's video, please comment your mail address and I will mail you the notes. So let's go and see aplastic anemia. So, by definition, it's deficiency of circulating erythrocytes and all other formed elements of blood secondary to arrested development of bone marrow cells. Which means, body stops producing enough new blood cells. The condition leaves you fatigued and more prone to infections and uncontrolled bleeding. Anyone can get aplastic anemia, but it's more likely to happen to people in their late teens and early 20s, and the elderly. Males and females have about an equal chance of getting it. It is more common in developing countries. There are two different types: acquired aplastic anemia, and inherited aplastic anemia. Inherited aplastic anemia is caused by gene defects, and is most common in children and young adults. If you have this type, there is a higher chance of developing leukemia and other cancers, so see a specialist regularly. Acquired aplastic anemia is more common in adults. Researchers believe something triggers problems in the immune system. The possibilities include viruses like HIV or Epstein-Barr, certain medications, toxic chemicals, radiation or chemotherapy treatment for cancer. Red cells carry oxygen around the body. White cells fight infections. Platelets prevent bleeding. Your symptoms depend on what type of blood cells you're low on, but you may be low on all three. These are common symptoms for each: pancytopenia, petechiae, purpura, pallor, weakness, fatigue, tachycardia, low red blood cell count, tiredness, shortness of breath, dizziness, headaches, chest pain. The following tests can help diagnose aplastic anemia. Blood tests. Normally, red blood cell, white blood cell, and platelet levels stay within certain ranges. In aplastic anemia, all three of these blood cell levels are low. Bone marrow biopsy. A doctor uses a needle to remove a small sample of bone marrow from a large bone in your body, such as your hip bone. The sample is examined under a microscope to rule out other blood-related diseases. In aplastic anemia, bone marrow contains fewer blood cells than normal. Confirming a diagnosis of aplastic anemia requires a bone marrow biopsy. So the main interventions are: if the case isn't severe, patient may not need treatment unless or until blood count drops below a certain level. If it does, doctor may prescribe hormones or drugs to help bone marrow make more blood cells. They may also suggest antibiotics and antifungal medications to fight infection. Most people with aplastic anemia will need a blood transfusion at some point. If blood count is very low, doctor may suggest a bone marrow or stem cell transplant to boost body's ability to make blood cells. Patient would need a donor whose blood is a close match. This procedure can sometimes cure aplastic anemia, but it is most successful in younger people, with the donor marrow from a close relative. If a transplant is not an option for the patient, doctor may prescribe medication to try to stop body from attacking your bone marrow. Lifestyle and home remedies. Resting whenever need to. Anemia can cause fatigue and shortness of breath with even mild exertion. Take a break and rest when need to. Avoiding contact sports. Because of the risk of bleeding associated with a low platelet count, avoid activities that can cause a cut or fall. Protecting yourself from germs. Wash hands frequently and avoid sick people. If patient develop a fever or other indicators of an infection, see the doctor for treatment. Thanks for watching. Please subscribe the channel for more videos.